Today, you're speaking with Dr. Richard Boles, and we're talking about cyclic vomiting. Dr. Boles, can you first just explain to us what cyclic vomiting is?
When a patient has a stomach flu, they'll have nausea and vomiting, and it's very acute, very severe, and then it goes away. But what if it comes back a month later, and then in the next month, and then the next month, and then the next month? That's not having the stomach flu. That's cyclic vomiting syndrome. What cyclic vomiting syndrome is episodes of nausea and vomiting, usually with lethargy and fatigue, and they're stereotypical. Each patient, they're different, but in the same patient, each episode's very similar to each other. Episodes can last hours, usually days, and sometimes weeks.
Physicians that are seeing patients dealing with vomiting, how easy is this to diagnose? What maybe are they thinking it is that it isn't? How is it treated?
It's hard to diagnose, and usually it's not diagnosed. Most of the patients with this condition don't know about it. In fact, in two studies, one in Australia and one in Scotland, found that 2% of school-aged children have cyclic vomiting.
Wow.
Almost none of them had diagnoses. It's difficult because they get the diagnosis of the stomach flu for a long time, or other infections. Or sometimes they get a diagnosis of migraine, which isn't that far off it, because cyclic vomiting syndrome is a functional disorder related to migraine, and some of the treatments are similar. Or they can get, very commonly, that says, well, it's dietary, or it's nerves, psychogenic, or even that it's Munchausen by proxy, and that they're doing it on purpose to get out of school.
Wow.
And just many times, no one just knows what it is, and they don't have a diagnosis.
So what can someone do that's different than just treating this by waiting, anti-nausea medicine? What should someone do?
Well, first of all, cyclic vomiting can be severe. It can go on for years, even decades, and many times at these results. Each episode can be very severe, miss school and work, and hospitalization for dehydration and pain control is very common. First of all is to recognize the condition. And so then you can read about it and find out, oh, there are treatments for this. There are treatments to stop the vomiting episodes, though admittedly they're not all that helpful. And then there are treatments, prophylactic medications to avoid episodes. I use genetic testing to figure out exactly why a patient has cyclic vomiting and then use the medication for that, but that's not in wide use. But also, there's the realization that patients with cyclic vomiting syndrome have a degree of mitochondrial dysfunction. Mitochondria, the powerhouse of the cells, are needed for all cells to do just about anything. Energy is life itself. Without energy, people are predisposed towards many different problems, and one of it is cyclic vomiting syndrome. In my research, I found that pretty much everybody with cyclic vomiting syndrome have mitochondrial dysfunction, and mitochondrial treatments, in particular micronutrients, vitamins, minerals, cofactors, and other micronutrients, can be very helpful in patients with cyclic vomiting syndrome.
But don't we just get that from our diet? Don't we get enough nutrients from eating?
Well, certainly good diet will have the leafy vegetables for the B's and the fruits for the C's, et cetera, and important diet. And a good diet is important for general health as well as for gut health and brain health. But the amount of supplements that I give for cyclic vomiting syndrome are beyond what you can get from eating an entire salad bar in several restaurants on the same street. Is the bioavailability, the dosing are just too high to get from diet alone. So diet and supplementation are both important.
So walk us through what product would someone potentially use for cyclic vomiting from NeuroNeeds?
Well, for many years, I was using individual products such as coenzyme Q10, carnitine, riboflavin, which is vitamin B2. And then I started using more antioxidants like vitamin C and alpha lipoic acid, and finding that patients benefited dramatically. But that was difficult to do, to buy several different products and to offer them to children or older people that have cyclic vomiting to take them every day. So what I did is I spearheaded the development to put multiple micronutrients together in a mitochondrial cocktail. We have Energy Needs, which is capsules, and most of the patients take that, but some of the younger patients prefer to take Spectrum Needs, which is a powder. Energy Needs has 40 active ingredients, including all of the ones I spoke about and many other mitochondrial components, as well as other antioxidants, and it doubles as a multivitamin. Spectrum Needs has 33 active ingredients. It comes in, it's a powder form in 2 flavors, lemon and berry.
So the patients that you've treated with cyclic vomiting, what have you seen?
A lot of them, the problem goes away with energy needs or spectrum needs alone. And I add Q needs on there, a type of ubiquinol, a coenzyme Q10, which you really can't put in a powder form, is that the vomiting episodes either go away completely or become much less common. Some of the patients, particularly the more severe patients that need medication on top of that, but the combination of medication and these supplements can be extremely helpful. And the vast majority of my patients have few to no episodes now.
So it sounds like a good next step would be if someone thinks that they may be suffering with cyclic vomiting, or maybe you have patients where you've seen them multiple times and the treatments feel like you're just covering up something as opposed to fixing a root cause. There's two things you could do. One, you could order the product and try it, and you can do it directly from the website. Or if you have more questions, you can book a direct call with Dr. Boles. Dr. Boles, thank you so much for joining us today.
Oh, you're welcome.